Hi, welcome back to the podcast. I'm Dr. Lindsay Manzullo.
Dr. Christopher Nolikin. We're here today with two very interesting topics. The first topic is blood banking. So we've actually invited some guests from the opposite side, or maybe not the opposite end of the country, but the middle to western part of the country out in Colorado. We have our sister hospital out at Wheat Ridge actually has a blood bank. So we thought we'd invite some team members from there who run the blood bank to give us some information about that. So I think, Lindsay, the thing with veterinary medicine is like stuff magically appears in the fridge, right? Like,
Yeah,
you need blood, right? So an animal's bleeding or it needs some sort of replacement for some component of their blood, and we just like go to the fridge and there it is.
Yeah.
So there is quite a bit of magic behind that, actually. So our team members here, Tricia and Haley, can you guys give yourselves a little bit of a brief intro to the listeners or watchers?
Yeah, I'm Tricia. I am the manager that oversees the blood bank at Wheat Ridge Animal Hospital. I am a technician. Spent a lot of time giving transfusions, and it was just like you said. You open the fridge, there's blood there. You go ahead and give it. You don't really think about where it comes from or how it's processed. And over the years, I kind of started thinking about those things, and that's why I got interested in working in the blood bank and came over to Wheat Ridge to manage that side of things. So that's me.
Excellent. Hey, Haley.
So I'm one of the assistants, or actually the only assistant in blood bank. And it's a really cool area to get to work in. It's a different way to help animals that I really enjoy. And this is my first position in vet medicine, aside from client care, where I'm working more closely with animals. And I worked closely with Tricia and Kendall, our other technician, previously, and I thought, this was a great opportunity to learn more and expand my knowledge. And I just, you don't really think about animals getting blood just like humans. And so when I learned about this, I thought, oh my gosh, how cool is this? I want to learn more about it. I want to be able to help animals in a different way. So that's kind of how I transitioned into blood bank, and I absolutely love it. We develop these great relationships with our donors, so it's awesome.
Mm-hmm. Yeah. So, go ahead.
I was going to say, I think that people, often they think about like human blood banks, and it's something that's very familiar to them. So when we do bring up the concept of animal blood banks, people are like, wow, I can't believe you guys do that as well for your veterinary patients. And we've touched before on a previous podcast about the need for our blood and the fact that blood banks are something that is important for our veterinary patients. But how does your blood bank work at Wheat Ridge? Like, how do you guys have it set up, and how do you specifically, have that run?
Yeah, so we have like a little over 100 donors in our program, and what we do is we'll call them like every week. We're calling donors to get them scheduled, and we usually schedule them between 7 to 8 weeks to donate. And if it's more of an urgent need of blood, we'll call them in at 6 weeks at the earliest. Some donors will call a little bit later depending on the blood type, but they'll come in every scheduled time and do their donations, and they get showered with love and treats and hugs and kisses, all that. And we do provide blood products to other hospitals across the United States as well, definitely the Denver area, but quite often we're selling blood to other hospitals across the nation as well. So we're always in need of new donors joining our program.
So what is the difference? So you get owners to come in and allow their pets to donate. Do you have any donors that live at your hospital, or is it exclusively a community donation?
Our canine program is exclusively a community program. We do have feline donors that live at the hospital. I think that people are a little less wanting to let their cats donate. Cats typically need sedation. So we can monitor the health of the cats, and we can control that a little bit better if we have them in the hospital, and they get great care as well. They're also loved by our staff. We have giant cat rooms with giant windows where they can watch the birds and all that kind of stuff. So they get a lot of attention as well. But the canine program is strictly community.
Mm-hmm.
And how do you if you have a strictly community program, like for these canine patients, if that patient is a suitable donor?
We do have requirements for our donor program. There's a weight requirement of 55 pounds. They also need to be between the years of 1 and 6. We do retire them at the age of 9 as long as they continue to be healthy after the age of 6. And then we also want to make sure they have a friendly disposition. The donors that we bring in, our donors love coming in because they get all the attention, they get all the love, they get all the treats. So we want to make sure that it's a fun experience for them. They usually run in, jump all over Haley and Kendall, and kind of enjoy their time with us. So we want to make sure that they're happy and they're enjoying the process with us.
So most of them you didn't, or all of them, you don't need to sedate the dogs to do it?
We have a few that get a little bit of sedation, but for the most part, no. It's again, we want to make it a positive experience for them, and if we have to go to the lengths of using sedation, we prefer not to. Yeah.
Now, the amount of blood that you guys take for each individual donation, obviously it's going to be dependent on the size of the dog, I would imagine. But then, like with people, how you get a little apple juice and a little cracker afterwards, do you find that your canine patients, they need like a little snack or something afterwards?
Yeah, so we actually feed them. It's just like a very bland, like low GI diet that we'll give them. It's like a whole can that they get. And then during the whole donation process, they're getting a bunch of treats. So they definitely enjoy coming in. And sometimes we have dogs that they might have like some sort of food allergy. So we just have the owners bring their own treats and food, and we'll just give those to them as well. So they definitely get a lot of food while they're here. I think that's why they love us.
Probably.
So what do you do to the blood once you've collected it?
Yeah, so once we've collected it, we take it into the office area, and we have a super big centrifuge in there, and we will place those in there and spin them down, which will separate the blood from the plasma. And then once those are separated, I will put it in, it's like a squeeze chute. And then depending on, I'll know ahead of time if we need to get a double unit or a single unit. And then the squeeze chute is going to squeeze the plasma out into the satellite bag. And then again, I'll know where to stop it and everything depending on the weight. And once that's in there, I will clamp off the lines, not cut them off yet, but then I'm just trying to get the air bubbles out of the plasma, and then I'm mixing the blood bag. And then once I've done all that and gotten all the air out of both bags, I come next door and I'll recheck their red blood cell volume, so their PCV. And as long as that's in the range of what we're normally shooting for, then I can go ahead and come back and cut off the lines and tie them, and we put labels. And then we actually have we take pictures of our donors every time that they come in, and we put their picture on the bag. That way, when a dog does get a transfusion, they can see who the blood is coming from. And if they would like, they can send in a thank you card to the donor as well, which is really special.
Oh, I like that idea.
So sweet.
That's super good.
Yeah.
So would you say, I know you were mentioning that you do send them out to other hospitals across the country. Does it tend to be sort of within your geographical location, or you really have a vast, spread of sort of hospitals across the U.S. that you're supplying?
I think the furthest that we've sent blood is probably Tennessee.
Okay.
Yeah.
Do you agree, Haley?
So.
Yeah. We actually, my predecessor in the blood bank, she actually did a lot of research on the packaging and all that kind of stuff to make sure that we're shipping things appropriately. So we have these special containers that we use to ship, so we can make sure that the blood maintains its right temperature. And then we also, for the plasma, we use dry ice to do the shipping, so it stays frozen. So.
I think that's the biggest important thing that perhaps a lot of owners don't realize, is that not only do you use the blood on patients, but also it only has so long that it lasts, right? Yeah. So red blood cells, you cannot freeze them. You can't you have to just refrigerate them, and they will last a month in our fridges. Do you have any other, I guess fresh frozen plasma is the other part of the blood, and that will last a year in the freezer. Once you thaw it, you have to use it right away. And then it can be downgraded to what's just called frozen plasma, because after that 1 year of expiration, it just lacks certain factors. I would have to refresh myself. Perhaps you know what those things are. But yeah, so we have to continuously, like, sometimes we have to throw it out. You know, it really is terrible, but we, you know, try to purchase just enough blood so that we will use it in the amount of time that before it expires.
Yeah.
Yeah. So you guys also, you screen for blood types just like in humans. Can you give us just a little brief blurby about the different blood types in dogs and cats?
Yeah, I think right now in dogs, last I knew they've identified about over a dozen different blood type groups. But the one that we're most concerned with here, and the one that's most documented in blood banks anyway, it's called the DEA, or dog erythrocyte antigen, 1 positive or negative. The reason why that one's the most important is because it has the most potential to cause adverse reactions in dogs. So the negative dogs are the dogs that can more often, the dog blood that can more often be used in other dogs without as much concern, because they don't have the antigen that can cause those problems, or could potentially cause those problems, I should say. So that's the type that we try and recruit most often, but it seems like the positive dogs are probably more prevalent in the world.
So you do take donations from the positives too?
We do. So, we've also spoken with a lot of our hospitals that do purchase blood from us and tried to encourage them to do more typing on their end, on the recipient, so that they can use more type-specific blood because of the shortage of product that's available. So.
Yeah, that's from the clinical standpoint. You're always right. You have an animal in front of you, right, and you have an owner attached to it, and there's money and there's everything involved. So the ER doctor's tendency is to just grab the blood that they know they can give, the DEA 1.1 negative.
Right.
If a dog has not had a transfusion before, you can safely administer that, right? But then every time after that, if you've given it the wrong, any sort of blood transfusion, it could have developed antibodies against it, and you have to be more careful and do these, typing and cross matching. But if we could just type them first, then we could use the more common but less useful blood that is the positive, and reserve that universal donor blood, right?
Yeah.
We try to teach our ER doctors.
And the cats are a little bit easier, I guess, in some ways, just because even though cats still have different blood types, the vast majority of them are one particular blood type. And so it makes it a little bit easier sometimes.
I don't know, Lindsay, out there on the West Coast.
Oh, that's true. Actually,
yeah, if you asked our doctors at the Hawaii hospital, they would probably tell you they see a lot of big cats.
Wow. Yeah.
Yeah. So it is definitely by geographic. Yeah. So yeah, it's very interesting how it plays out that way. So.
Yeah. So a cat is born with the antibodies to react against the opposite type of blood. So if you have to type every cat. Or else you can kill that cat if you give it the wrong type. And we were saying, fortunately, there's A and B. There's also AB.
AB, yeah.
But that I don't think I've ever seen. But so the B cats here on the East Coast, it's maybe 1% of the cat population.
Well, it's like the exotic type of breed.
Yeah.
But I guess, in Hawaii, maybe they have the bees over there. That's cool.
And we actually have been lucky enough to find some bee cats and have them in our colony, and they're actually just domestic short hairs. So
really?
It's been, it's been really interesting to see more and more of those. And
So like our hospital group on the East Coast keeps 1 or 2 units of bee blood in the fridge at all times. And honestly, sadly, most of the time that blood expires, but every 6 months or so, we have a BCAT that we need, and we can call up that hospital and say, we need your unit, and we can get it. So that, otherwise it would be a multi-day delay to get that blood, and that might be too long. Yeah.
Well, that's I think it's quite fascinating to feel to know that you guys sort of have your own blood bank, though. That is such a great initiative to sort of take on and to be able to provide that for your patients within the hospital. I'm sure all of your doctors love the fact that they have a blood bank in-house. That would be just such a wonderful resource.
Yeah, the critical lists are very fun.
Yeah, right. I sort of wish I had a cat colony that I could go and love up when I was feeling stressed too. I imagine that might be another source of de-stressing at your hospital.
Yes, it comes in very handy for that. You always catch doctors in there doing their notes, calling clients on their phones, technicians just like chilling out with the cats and getting love, because you go in there and they just climb all over you. And
we had a colony at vet school, and those colony cats were the best treated animals around. They were just spoiled by everybody, and it was a wonderful place to go in there, do your note study, and the cats would just totally love it. So
definitely.
Yeah. So thank you guys so much for joining us. It's just amazing. I think you're the only hospital in our network that has a blood bank, and it's really fascinating to hear, everything that you do to keep the blood supply in your region going. We definitely could not be without our blood bank.
No, and it's exciting to also know that you're part of Ethos, just in the just a few states over. So it's kind of cool to have you guys on the show and meet you and have you guys discuss this very cool topic.
Thank you. Yeah, we enjoy what we do, and I enjoy the aspect of having this impact on the entire veterinary community and be able to reach out, even if it's not a pet in our hospital, to be able to help one across the country is just as amazing to me. So I enjoy it a lot.
Yeah, it's pretty great. I'm very grateful to work in this department specifically, but our donors, we really get attached to them. They mean the world to us. So it's very special. We love it a lot.
Excellent.
Well, thank you so much.